This is Boomer Life on CL 650.
Listen to the melody ring. Listen to the music on the
And welcome back. This is Boomer Life on CL 650. I'm Joanne Sutton. Today we're talking about the dramatic effects of hearing loss and the solutions that you can find with Next Gen Hearing. In studio, audiologist Dr. Ted Venema is here, and on the line with otologists Dr. Brian Westerberg and Dr. Jane Lee. They're ear, nose, and throat specialists in Vancouver at St. Paul's Hospital and the BC Rotary Hearing and Balance Centre. So we want to talk a little bit about the important role that audiologists play in the early detection of hearing loss. Maybe you could explain that, Dr. Venema.
Sure. The audiologist is more involved in the rehabilitation process. An audiologist doesn't do surgery. An audiologist also assists in diagnosing where the problem is. Is it the outer, the middle, or the inner ear? So the audiologist is quite highly trained in assessing the hearing loss and determining where exactly is the problem. Is it a problem of sound getting to the hair cells of the inner ear, or is the problem with the hair cells of the inner ear itself? Or could it be a tumor, of the nerve going from the inner ear to the brain? So we help to diagnose the site of problem.
Is this a long determining diagnosis, or is it something that can be done fairly quickly?
It can be done fairly quickly. It's done on what we call an audiogram. And first, people listen to headphones and raise their hand when they hear tones. We measure how sensitive the hearing is for bass, mid, and treble. And then we take off the headphones and we put a little black box on the bone behind your ear. If you put your finger behind your ear and feel that bone, we'll deliver the tones through that. And we'll compare how their hearing was when we bypassed the outer ear and bypassed the middle ear and set the sound straight through the bone to the cochlea or inner ear itself. That helps us determine, is the problem inner ear or is it the outer or middle ear? Then we test the person with what they call tympanometry. We can assess to help further assess, where is it the middle ear again? Is it with those little bones? Is there an ear infection? Did the person lose his or her hearing due to an ear infection, or did the person lose his or her hearing due to damage to the inner ear, which surgery can't fix, by the way? Inner ear pathology is by far the most common hearing loss, and it's not usually medically treatable.
So let's talk about some of the differences in hearing loss and some of the different outcomes. I know we've covered it earlier in the show,
Sure.
but I think we can get a little more specific now. So Dr. Venema, you mentioned you sort of in general terms, there's a number of situations where this hearing loss can be fixed with a hearing aid.
Yeah, by far the most common treatment for routine hearing loss that people get as they get better with age, is hearing amplification by way of hearing aids. That's by far the most common treatment. If, as Dr. Lee said earlier, a hearing aid is going to always make that ear get infected, or the ear is draining, or the person simply doesn't have an ear canal, which happens, then that person could be a candidate for a bone-anchored hearing aid, and as she mentioned. But that assumes that the inner ear is still fine. So if the problem is outer or middle ear and the person can't really wear a hearing aid, a conventional hearing aid, then a bone-anchored hearing aid, as she was mentioning earlier, could be a solution. That's not a common solution, a lot less common than hearing aids, but for the person who's got inner ear damage that's really severe, and that the person's hair cells are so damaged that the person can't really wear a hearing aid because that's not really an option. It's beyond the scope of a hearing aid. For that person, a cochlear implant, as Dr. Brian Westerberg was describing, could be something that could be done.
Okay, so Dr. Brian, let's bring you in here. What type of a candidate, how is it determined that someone would need a cochlear implant?
The criteria are changing over time, Joanne. It used to be that people had to have essentially no residual hearing whatsoever, and it was only them that we put in the cochlear implant. We've come to realize that many people with an implant, with the new technology, the new software programming, the new electrodes that we have available, do far better with the implant when they reach a stage where their hearing aids are not working so well.
Yeah.
We have different criteria. We have audiometric criteria, so the audiologist will help do hearing assessments. We have surgical criteria where Dr. Lee and I will look at the ear and just make sure there's no contraindications to putting in the implant. And then there's a commitment on behalf of the patient to have the procedure and to follow through with the programming. It's not, as we said earlier, it's not simply a matter of flipping a switch, and there has to be that commitment on the patient side. They have to have realistic expectations about what to expect with the implant. So all of those things come into consideration.
I don't mean to be a Debbie Downer here, but is there ever a situation where you don't have a solution, that surgery is not going to help?
There can be. So the cochlear implant is reliant on having a cochlear nerve. Some children are born without cochlear nerves. We have to have a fluid-containing space in the cochlea in order to put the electrode in, which then stimulates those nerves. People who have had meningitis or bad skull fractures, sometimes that inner ear, the cochlea, gets disrupted and or filled with bone or scar tissues. We don't have space to put in the implant. We do have other devices called brainstem implants where you can put the electrode on the brainstem where the hearing nerve enters the brain rather than putting it in the cochlea. That technology is good, but it's not near as good as a cochlear implant, unfortunately.
So it's rare that you don't have a solution, is what I'm taking from your explanation. But I think you've given a lot of people hope. Well,
I think what's frustrating for us, I think, is not often the patients who are a candidate for a cochlear implant. By and large, they do well. The people who really struggle are the people who the hearing aids are not working great for, and yet they're not yet a cochlear implant candidate. And that group is getting smaller and smaller over time. As the implants get better, we're implanting more of those people and finding they're actually doing quite well with the cochlear implant. So long story short, I think we do have much more to give hope to people now than we had even 10 years ago when I was putting in these implants.
So one thing that I will take away from today's show is that hearing aids don't work like glasses.
No, they don't.
It's not an automatic correction. No. It's not like instantly you can hear the birds singing again.
No, with vision loss, usually light isn't reaching the back of the eyeball, the retina, which changes light into electricity, and electricity is the language the brain understands. That's usually quite fixable with glasses because glasses refocus the light. But with hearing, it's like the retina, in quotes, of the ear itself is damaged. It's like I scratched the back of your eyes and now go ahead and wear your glasses. So hearing aids have a good name. They're an aid, like a cane for a bad knee. They help, but they don't replace the real McCoy.
Very good point. Let's talk a little bit quickly about a very exciting fundraiser that's not that far in the future here. It's the Vancouver Rotary Bike-a-thon. Basically, we call it the Ride for Hearing. And Brian, I know you've been involved with this for some time now.
Yeah, the first time I did it was the year I came out to do my year of research, and I arrived, I think, on July 1st, and every year it's the second Sunday in July, and I was told I was going to be doing this bike ride, having not been on a bike for probably 6 months before that. That was a painful day, but since then I've become a little bit more prepared for it. Every year it's a ride from from Brentwood Mall in Vancouver to Harrison Hot Springs, so 120 kilometers. Raises money for helping people with hearing loss within the province of British Columbia. It's run by the Vancouver Rotary Club, and they have a hearing foundation that the money goes to. Each year they've raised more money, I think, than the year before. Last year, I think they raised close to $170,000 in one day. And that money is well spent in helping people with hearing impairment in the province.
So the ride for this year is scheduled for Sunday, July 9th, 2017. It's the Ride for Hearing, sponsored by the Rotary Club. Dr. Lee, has Dr. Brian Westerberg dragged you into this event as well?
He has, and dragged is a very appropriate way of saying that. If only I could just attach a bungee cord between my bike and his, it would be an easier day. It's a great day and for a great cause, and it's a quite enjoyable event with people of all abilities that are participating.
Not that we're competitive at all, but each year it's a race to see who gets there first and who raises the most money.
I'm pretty sure that I beat Brian by 1 second last year.
I'm
I
sensing
pushed him over the start line earlier in the meeting.
I am sensing a strong line of competition between the two of you.
A little bit.
Friendly competition.
Well, that's wonderful. I just want to thank both of you for your contributions to today's show. Dr. Brian Westerberg and Dr. Jane Lee from the BC Rotary Hearing and Balance Centre at St. Paul's. Thanks again for joining us.
Thank you, Joanne.
This is Boomer Life on CL 650. Today we were talking about the dramatic effects of hearing loss and the solutions that you can find with NextGen Hearing. We were in the studio with NextGen's Dr. Ted Venema and on the phone with otologists Dr. Brian Westerberg and Dr. Jane Lee, ear, nose, and throat specialists in Vancouver. Thanks to everyone for their contributions today, and thanks to you for listening. You can always get more information online at nextgenhearing.com. This is Boomer Life on CL 650.